Bismillahirrahmanirrahim. Hello everybody. So here we have another question with a very short stem. So which stated that a 32-year-old woman is evaluated at her 32nd week of pregnancy. Laboratory results are as follows: arterial pH is equal to 7.45. Partial pressure of oxygen is equal to 110 mm of Hg. Partial pressure of carbon dioxide 30 mm of Hg. Bicarb 20 milli equivalent per liter. Hemoglobin 11 gram per deciliter. WBC. White blood cell count is 9000. Sodium 134. Potassium 3.6. Chloride 102. Blood urea nitrogen 5 mg per deciliter. Creatinine 0.6 mg per deciliter. So which of the following best explain this patient acid base status? So we have to find out that what is wrong with her acid base profile. So first of all, the choice A, anemia; choice B, hyperemesis gravidarum; choice C, normal pregnancy; choice D, preeclampsia; choice E, pulmonary embolism. So first of all, we have to see that what's wrong with her acid base profile. So let's see that her arterial pH is 7.45. This is a normal pH, as normal pH is equal to 7.35 to 7.45, 7.45, but the average normal pH is 7.40. This is the average normal pH, mm of Hg. So then we can see the partial pressure of oxygen 110 by mm, 110 mm of Hg. This is also normal partial pressure of carbon dioxide. As we can see, the normal partial pressure of carbon dioxide is equal to normal partial pressure of carbon dioxide is 35 to 40 mm of Hg. This is normal partial pressure of carbon dioxide. So in this question, the partial pressure of carbon dioxide is decreases to a little bit. This is decrease. Then we can come to the bicarb concentration. Normal bicarb concentration is 22 to 29 milli equivalent per liter. But here the bicarb concentration is also decreased to a little bit. Here it shows the 20 milli equivalent per liter. The remaining laboratory finding are normal, but we have to consider these two: the partial pressure of carbon dioxide, which is little bit decreases, and the bicarb concentration, which is also decreased a little bit. So we can come directly to the question: what are they asking? So they are asking that which of the following best explain this patient acid base status. So first of all, we have to see. I think so. This is a normal pregnancy, normal changes during the pregnancy, because here we can see the correct option is the choice C, normal pregnancy, because as we already know that pregnancy causes increased progesterone concentration during the first trimester, and progesterone concentration, increased progesterone concentration changes the homeostatic set point in the medulla, which is the respiratory center of the brain, respiratory center in the brain. As a result, the respiratory effort exaggerated. The normal hyperventilation of pregnancy is characterized by increased tidal volume. So what is tidal volume? Progesterone, increased progesterone concentration causes increased respiratory increase the homeostatic set point in the medulla to increase the respiration. Progesterone concentration increase respiratory center in the brain, which causes hyperventilation of the lungs. By hyperventilating the lungs, the patient pH will goes to respiratory alkalosis, because the carbon dioxide is leaving the body rapidly. So the patient pH will go to respiratory alkalosis. By respiratory alkalosis, during the first trimester, the progesterone concentration is a little bit low, but during the later stage of pregnancy, the progesterone concentration increases too much. By increasing the progesterone concentration increases too much, the body will hyperventilate too much to increase the oxygen demand during the pregnancy. By doing so, By doing so, the progesterone concentration increases, which causes hyperventilation. By doing so, the, the metabolic alkalosis will occur. But during the metabolic alkalosis, the body will be compensate. So how the body compensate? The body will compensate by metabolic means. So how the body compensate? The body will lower the bicarb concentration in the blood, in the serum. Bicarb concentration will be low. As we can also see here, the bicarb concentration is 20 milliequivalent per liter, but the normal is 22 to 29 milliequivalent per liter. So this is a normal physiological change during the pregnancy. So it is a normal a normal pregnancy, and it is a normal pH. So let's come to the incorrect point. Why the anemia is incorrect? So as we already know that from her laboratory finding, the hemoglobin concentration is 11 milliequivalent per liter, and anemia is defined as hemoglobin concentration less than 11 gram per deciliter in the first and third trimester, and less than 10.5 gram per deciliter in the second trimester. So this is also incorrect. Come to the B, hyperemesis gravidarum. As we already know that hyperemesis gravidarum usually happen due to increased HCG concentration during pregnancy in the first trimester. The HCG concentration increases. As the HCG, human chorionogonadotrophin concentration increases, which causes increased significant vomiting and causes severe volume depletion. So the choice is also incorrect, because the patient is not suffering from any dehydration or something else, or vomiting. Come to the choice D. Choice D states the pre-eclampsia. As I already explained to you, that pre-eclampsia happen after the 20 week of gestation, and the patient usually suffer from hypertension, proteinuria, and in-organ damage. So this is also incorrect. Come to the choice E, pulmonary embolism. As we already know that pregnancy is a prothrombotic state that can increase the risk of DVT, deep venous thrombosis, and pulmonary embolism. But this patient is not suffering from any of these points. So let me revise again. Why this is normal pregnancy? Because from the laboratory finding, the partial pressure of oxygen is normal. The partial pressure of carbon dioxide is little bit decreases. The normal partial pressure of carbon dioxide is already written here, that is 35 to 40 mm of Hg. This is normal partial pressure of carbon dioxide, and normal biocarb concentration is 20 to 29 milliequivalent per liter, but here it is 20 milliequivalent per liter. As I already told you that during pregnancy, during first trimester, the progesterone concentration increases, which causes which goes to the medulla and increases the homeostatic set point for the respiration. So by doing so, the lungs will hyperventilate. By hyperventilation of the lungs, the partial pressure of carbon dioxide will drop, because the lungs hyperventilate and rapidly getting out the carbon dioxide. Why the body is doing this? Because to increase the oxygen demand for the body. But during the later stage of pregnancy, as during the third trimester, the progesterone level increases too much. By increase the progesterone concentration too much, the body will compensate for the respiratory alkalosis. How the body will compensate by respiratory alkalosis? By lowering the bicarb concentration in the serum. By lowering the bicarb concentration in the serum, as we already see here, that the bicarb concentration in this patient is 20 milliequivalent per liter, but the normal bicarb concentration is 22 to 29 milliequivalent per liter. So that's why this is normal pregnancy changes. Thank you.